Lung cancer is one of the leading causes of cancer-related deaths worldwide. But here's the good news. Catching it early can dramatically improve the chances of successful treatment. The challenge, however, is that early symptoms of lung cancer are often subtle or mistaken for other, less serious conditions. That's why it's so important to know the warning signs and act quickly if you notice something unusual. In today's video, we'll dive deep into lung cancer, 10 early signs and symptoms you shouldn't ignore. By the end, you'll have the knowledge to spot potential red flags early, whether for yourself or someone you care about. Let's get started. Number 10. Persistent cough. A cough that lingers for weeks or months can be one of the first signs of lung cancer. It's not your typical cough from a cold or flu. It's persistent, it may worsen over time, and it doesn't respond to usual treatments. Here's what to watch for. A dry or wet cough that doesn't improve. Changes in an existing cough, especially if you're a smoker. Coughing that leads to discomfort or disrupts your daily life. In some cases, the cough may produce blood or rust-colored mucus, which is even more concerning. If your cough feels unusual or lasts longer than 3 weeks, don't hesitate to consult your doctor. Number 9. Shortness of breath. Have you noticed yourself feeling winded after activities that used to feel easy, like walking upstairs or carrying groceries? Shortness of breath, also known as dyspnea, can occur when tumors obstruct airflow or cause fluid buildup around the lungs. This symptom can develop gradually, so it's easy to dismiss at first. Some people only notice it when they lie down or try to take a deep breath. Keep an eye out for these signs. Feeling out of breath with minimal exertion, struggling to catch your breath after light activities, waking up at night due to difficulty breathing. Don't ignore breathlessness. It's a signal your body needs attention. Number 8. Chest pain. Chest pain can be another early indicator of lung cancer, especially if it's persistent and unexplained. The pain may feel sharp or stabbing, dull and achy, or worse with deep breathing, coughing, or laughing. Lung cancer-related chest pain often occurs when a tumor presses on nerves or surrounding tissues. It might also spread to the shoulders, back, or arms. If you're experiencing ongoing chest discomfort, it's worth investigating. Number 7. Hoarseness or voice changes. A sudden change in your voice, such as hoarseness or a deeper tone, might not seem alarming at first. However, this can occur if a tumor presses on the nerve that controls your vocal cords. Things to note: hoarseness lasting more than 2 weeks, voice changes not linked to a cold or overuse, and accompanying symptoms like a sore throat or cough. Voice changes are easy to overlook, but they can be an important early sign, especially if they persist. Number 6. Unexplained weight loss. Losing weight without trying is a common symptom of many types of cancer, including lung cancer. Tumors can produce substances that affect your metabolism, leading to weight loss even if you're eating normally. Here are some signs to watch for. Unintentional weight loss of 10 pounds or more. Loss of appetite or feeling full quickly. Weakness or fatigue accompanying weight loss. If you notice these changes, it's a good idea to discuss them with your doctor. Number 5. Fatigue. Feeling tired isn't unusual, but cancer-related fatigue is different. It's often described as a deep, overwhelming exhaustion that doesn't improve with rest. Lung cancer-related fatigue may be caused by the body using extra energy to fight the cancer, lower oxygen levels due to reduced lung function, changes in your blood, such as anemia. If you're feeling persistently drained and can't identify a clear reason, it's time to pay attention to your body's signals. Number 4. Frequent infections. Recurring respiratory infections like bronchitis or pneumonia can sometimes be a sign of lung cancer. Tumors in the lungs can block airways, creating an environment where infections are more likely to develop. Here's what to notice. Infections that come back frequently or linger longer than usual. Symptoms that don't fully resolve with treatment. New respiratory symptoms after recovering from an infection. If you're catching colds or respiratory illnesses more often, it's worth discussing with a healthcare provider. Number 3. Wheezing. Wheezing, or a whistling sound when you breathe, is often associated with asthma or allergies. However, it can also be caused by lung cancer. Tumors in the airways can narrow or block the passage of air, leading to this symptom. Key points to consider: new onset wheezing without a history of asthma, wheezing that doesn't improve with usual treatments like inhalers, and accompanying symptoms like shortness of breath or cough. Don't ignore new or worsening wheezing. It's always worth checking out. Number 2. Coughing up blood. Coughing up blood, also known as hemoptysis, is a serious symptom that should never be ignored. This can occur due to bleeding in the airways caused by a tumor. What to watch for? Blood-streaked mucus, bright red blood when you cough, accompanying symptoms like chest pain or breathlessness. Even if this happens just once, it's crucial to seek medical attention immediately. If you're finding this video helpful, don't forget to like this video and subscribe to our channel for more health and wellness tips. Have you experienced any of these symptoms or know someone who has? Share your thoughts in the comments below. We'd love to hear from you. Number 1. Shoulder or upper back pain. Pain in your shoulder, upper back, or even arms can sometimes be a sign of lung cancer, especially if it doesn't seem related to physical strain. This pain may be caused by a tumor pressing on nerves in the chest or spine, spread of cancer to bones or other tissues, changes in your posture or breathing due to discomfort. If you've been dealing with unexplained, persistent pain in these areas, especially alongside other symptoms, don't dismiss it. Lung cancer symptoms can be subtle, but knowing what to watch for can make a significant difference in early detection and treatment. If you or someone you know is experiencing any of these 10 early signs, don't wait. Schedule a checkup with your doctor as soon as possible.